Alright kids, it's been an interesting year, and what took place the previous 12 months are going to impact the future. This isn't going to be a year in review or a recap of 2022, but in January, I became a freelance content creator for TYT. I'm a political commentator and a video contributor for Rebel HQ, along with a correspondent for their live shows. So, some may be watching this now because they've seen me there. Hey, my architect knows Japanese. This position allowed me to quit my job at Nationwide Children's Hospital where I worked for 7 years. I'm so grateful for that. And sure, this move will pay dividends and provide for me and the fam while furthering my career. But, well, I guess the reason why I'm talking about today's topic ahead of Christmas is because in July, I got myself a gift that keeps on giving when I finally decided to get braces, and that's what we're going to talk about. I say finally because it's been a long time coming. It's something I've needed. I mean, just watch my previous videos. You'll see if you haven't already. Plus, some in my comment sections reminded me of what I hope to do and even plan to do for a while in a discourteous way. So you can understand why I felt like I can't be on the internet and TV presenting facts, busting myths, and correcting misinformation without fixing my teeth, right? So, if you're looking to get braces and want more information, then look no further. If you had braces and you want to reminisce, I'm here for it. Or if you currently have braces and misery loves company, I'm glad you visited my YouTube channel. Not to scare the noobs. For a while, I was under the impression that braces were just for kids. I was too old to get them or something like that. Maybe having them would be something I would be ashamed of or a sign that I didn't have money somehow. But as you'll see today, based on everything you go through as an adult with braces, including how much they cost, we'll get back to that later, I showed mine off like this. Before I continue, I'm not going to mention the name of my orthodontist office. I don't want anyone to think that I'm only saying nice stuff about them because they're like paying me to do so. However, the staff has been nothing but nice and accommodating and understanding. I've never felt like they were like, ugh, man, you too old to be looking like this, or take care of your teeth, my dude. They have gone out of their way to make me feel comfortable, relaying stories about other patients and their own experiences with braces. One more thing though, if you too, the viewer, is also a political commentator, keep it to yourself. Sure, I can back up what I say with facts, stats, and data. And not that this has happened, but I can imagine that there's nothing like having a disagreement with the person who is in charge of making you look good, using sharp objects in your mouth every other month. Anyways, after I made initial contact and called in order to schedule a consultation, I met with them in their office and we went over my goals and what to expect. They told me that the process for me specifically would take 2 years in addition to having to wear retainers for pretty much the rest of my life. Once I agreed to services and procedures, they then took pictures and x-rays and scans of my teeth prior to me ever sitting in the operating chair. Operating chair might be a little dramatic, and I probably shouldn't compare lying down in that chair, looking up and watching metal go in and out of my mouth to being turned into a cyborg like that scene in RoboCop. Options for braces are traditional, the metal ones you think of when someone says braces, ceramic, which is what I have and is more incognito, lingual goes behind the teeth, but not only did my orthodontist not offer those, they discouraged people from getting them, and Invisalign. I was too far gone to get these, and I may upgrade to those in the future once things get a little more straightened out. Now, costs associated with the braces that are available to you increase just like this, in the order of the kinds of braces I just listed, from least to most, and kind of depends on the severity of your needs. So, what started with me simply getting braces on the top row was done not only in order to, again, get things straight, but to make more room for the bottom, despite me already having an overbite. Friends of mine didn't even notice I had braces on my top row of teeth for a while, but things got a little more visible as time went on and more was needed. I was well aware of what would be added weeks in advance, by the way. My situation is so real that something that I can only describe as permanent hard galls were placed on the bottoms of 4 of my top teeth in order to open up and prop up my bite so my mouth didn't bite down as far as I usually do. Furthermore, space needed to be created for my canines, so they added coil springs. There are 3 types of coil springs. An open coil creates an opening in between 2 teeth, which is what I have and is necessary for me. A closed coil closes the gap between 2 teeth, and passive coil springs maintain space and they hold the teeth in position. I guess now would be a good time to go over some drawbacks. First and foremost, I think I talk weird. Nobody agrees with me and they say I sound fine, but that's the kind of thing you say to somebody who talks weird. It's really hard for me to say the S and T sounds. Conservatives. Trumpers. Also, food gets lodged in pockets and places in my mouth. One time I was eating pizza at a restaurant and a whole green pepper was stuck on top of my braces on my front 2 teeth. I caught it before the wait staff walked over and asked how the food was, mostly because I've learned to constantly check while I'm eating and especially after I'm done. Eating rice and salad are the weirdest 2 foods to chew with braces that I can think of right now. Food restrictions are what you would think they are. Avoid tough, hard, crunchy, sweet, and sticky foods. With so much being done, you should know that thus far, no appointment has lasted more than, say, 40 minutes. They may actually be around the 30-minute mark. This includes getting braces on my top teeth, then my bottom teeth a few months later, and each adjustment. At the current rate, I get adjustments every 6 weeks, which leads me directly to pain, literally and figuratively. The actual process of getting braces on and getting adjustments is relatively pain-free, but from about 8 hours after I leave the orthodontist to 48 hours later, my teeth get so sore. For me though, it's all good until I try to bite down on food, like even a sandwich. I eat a lot of bread. I like bread. Sometimes when I try to use my tongue to get trapped food out of my braces, and I kid you not, a taste bud will get caught in the coil springs and it doesn't feel good. Even the worst pain was from brackets and posts from my braces rubbing up against the inside of the side of my mouth. Felt like I was getting cut inside of my cheeks every time I said something, and I talk a lot. It's literally my job. Now, the orthodontist did provide me with a wax I could use as a buffer between my braces and cheek. They said gum does a better job at that, but it has to be sugar-free. I think I've used this method, twice, because I would rather get the healing process over with. They also gave me a fancy toothbrush, an inner ortho brush, and floss threaders, a special mouthwash for canker sores, and other stuff. I would say for free, but come on. I pay for this stuff too. With all that said, Delta Dental, which was the dental insurance company I had at the time, didn't cover anything at all. I learned that adult orthotics aren't usually covered except for certain providers and situations. I don't even remember what I was told when they explained it to me because my eyes and ears glossed over once financing told me that my braces would be $8,000. I mean, rob the jewelry store and tell them make me a grill. Rob the orthodontist, tell him make me some braces. They offer 3 payment options, one being paid all up front for a discount, the other 2 being monthly payments. I wanted so bad to give that bill to my mom and have her pay for it, but according to her, I had the opportunity to get braces when I was a teenager, but I told her no. Too vain to have metal in my mouth, but not vain enough to want to walk around with crooked, overcrowded teeth? Come on, man. Look. It hasn't even been 6 full months yet since I got my grill, and I already see a difference. I'm scheduled to get rubber bands in a little while. Having braces as an adult can be problematic though. It's usually harder to rearrange misaligned teeth in the mouth as the patient gets older and might take more time and patience compared to growing kids whose bones are still growing. For some adults, braces may not have been affordable when they were younger. Others may have had braces but didn't continue to use retainers and their teeth shifted back. One study from 2011 found that 68% of adults with braces got them to improve their smiles, and 35% got them, quote, to improve the appearance of my face. According to the study, about half of the adult patients surveyed sought treatment themselves. But there are upsides. Adults tend to take better care of their braces than their younger counterparts. While kids may not be as vigilant about wearing their retainers or avoiding certain foods, adults generally have a better dental hygiene regimen. Part of this may stem from realizing just how expensive and valuable braces are because they're often considered cosmetic and elective treatment. Most health insurance plans, again, won't cover orthodontic treatment for people over 18. Per the CDC, the percent of adults age 18 and over with a dental visit in the past year is 63%. Up-to-date stats are difficult to come by, but a report stated that 1 million adults had seen the orthodontist in the United States and Canada in 2012. That was a 40% increase from 1989. In 2014, it was reported that that number had climbed to 1.4 million. Today, older adults are getting their teeth fixed in record numbers. According to Humana, more than 4 million Americans wear braces and 25% of them are adults. There's a bunch of us out there. We shouldn't even need people coming up to us and say, let me see your grill. You want to see my what? I'm already smiling for you. Be proud, because in a little while, we're going to be all right.
Just got braces as an adult male, and a lot of people might be thinking I'd be embarrassed by these, but no, I'm not, okay? These cost $8,000, and it wasn't covered by healthcare and not paid for by the government. This is out of pocket. So as far as I'm concerned, this is a flex. These are more expensive than gold grills, literally, and I will treat them as such, all right? This is a fucking flex.